What if I told you that your stretching routine is actually making your low back pain worse? So here with Brian, we're here at CrossFit Casual in downtown Boise. I want to go through what low back pain is and a little bit about why that stretching routine might just be provoking your low back pain more and more. Brian's been telling me about his low back pain. He's having pain in the mornings, and then especially when he's getting up from a sit to a stand. He works out just fine, next day fine, but this lingering little nagging 1 or 2 out of 10 pain. Stretching routine every night, yeah?
Trying to, yeah.
Okay, and then do you feel pain during that or not really?
Not too bad, no.
Okay, all right, so oftentimes we'll feel a little bit of pressure here. Let's have you turn around. We'll feel a little bit of pressure in that low back, especially if we kind of lean to these corners, right? And that's a really common presentation right there at that low back. Basically, muscles get sore, right? You've worked out, but yet you've never had muscle pain that lingered for months or years later. That's not what's happening. And unfortunately, especially at that level there, it's actually a protective tightness in the muscles that are locking down and causing you to brace the low back so that you don't continue to provoke that mechanism. Mm-hmm. So Brian, you said you've been stretching out, right? And then yet it just kind of keeps lingering, right? Mm-hmm. So what's going on is your muscles are really they're not actually tight, and those aren't what's causing your problem. They stiffen to protect you. Okay, so that routine is actually probably provoking some of the pain. So those muscles are just doing their job, okay? They're actually trying to brace you, and so you feel this tightness, so you think, hey, I should stretch. I want to kind of stretch this away. If I loosen up, it'll be better. So that stretching in your low back, I mean, it gives you short-term relief, right? But what's happening is you're just continuing to perpetuate, and you're keeping that low back pain very sensitive. And that's why, again, as you go from a sit to a stand, you feel it more. So what I'm gonna recommend is we actually avoid a lot of these big hitters, which you've probably been doing in some of your stretching routine. Yeah, like the big ones are like a toe touch. Let's say we start with that. That one, again, puts a lot of leverage. You actually overpower those small stabilizers in your back. And so those continue to lock down more to continue to protect you. Figure 4 stretch, that side lying type of like twisting stretch that we would do, or laying down. That's a really common one. A pigeon stretch as well. They're all fine when there's no problems, but the second you start having issue and we keep doing those more, you wind up continue to perpetuate the same issue. In the office, we'd obviously use manipulation and adjustments to your spine, and that'll just do a massive amount of decompression for those disc spaces. But at home, or even in the gym, let's have you actually lay down for me. I want you to lay on your stomach and kind of bring your elbows up underneath into right there. Good. So relax into that for a moment. Good. Do you feel okay in the low back?
Yeah.
Yeah, good. So we're just getting that spacing, right? We just want to open up those disc spaces and decompress that low back. He can do this anytime, even mid-workout, but as long as it's very brief, about a minute. This is a very low risk, high reward position. And then as far as getting back to your squats and deadlifts, obviously elevated deadlifts off the block are always gonna be better for you. Trap bar is always indicated as you ease back into deadlifting, and then a split stance whenever possible. So split stance with your back squats, lunging, box step-ups. Anytime that you have that staggered stance, you really bypass a lot of the load that you're putting across the low back. So let's say that you had that injury just last night, all right? This next day, you're totally fine to walk. Walking is always gonna be indicated, and it's probably safe. And assuming you don't have more serious injury, it's not that you wanna do bed rest. All right, they've shown that's just going to keep perpetuating your problem as well. But you're just going to do a version of walking, laying, or that decompression position I showed you. And those are probably your safest start in this short term until you can get it checked out.
Gotcha.
Okay. So there's something called a McGill Big Three. Have you ever heard of that? No. So it's a combination of like a bird dog. You ever done the bird dog, right? So there's a bird dog. You can do side planking, or you can do a suitcase carry. Just a normal plank as well. Just stuff that maintains a neutral spine as you're building it back and getting some of that sensitivity as that has calmed down, and you're building back that strength around your spine. So those are those very easy but fundamental positions to start with. Okay, before you're hinging and moving into the split squat like I talked about, or a trap bar deadlift. But even hinging in shorter, maybe just half the range, kind of stopping above the knee, just to initiate and reactivate the glute and hamstring. To bypass even any load across the low back, but still get that activation, the safest one is still a glute bridge. So you're on your back, knees are bent, you kind of have them, feet in a moderate distance from you, and you're picking the hips up. If you can do those without pain, then absolutely, that's the way to start going. Sometimes you'll feel a little bit of a pain with that, right at that waistline and maybe hold off a little longer. But if you're able to do that without pain, then absolutely start cranking up the volume with your glute bridging, as well as just body weight lunging, air squats before you start to load those. So low back pain is more than just tight muscles, right? It's often, again, misleading that we should just stretch it, but you're usually provoking your pain. So you want to do the recommended stuff that we talked about, as well as be super careful in the mornings. The mornings are when your low back is going to be very susceptible to re-injury or provocation, and the rest of the day will pretty much be a -1 because it started off with irritation in the morning. If that stretching routine is working for you, that's great, and there's no problem with doing it. But if you keep doing that and your low back pain hasn't really changed in a year, you probably should ask yourself if that's actually helping you, or it's maybe adding a little bit of that sensitivity that just never seems to stop. Make these changes. I guarantee you, it's worth the try, because it could be huge for you, and I could be speaking directly to you with these points.